Welcome to American Medicine Today, presented by the Bonati Spine Institute, featuring the internationally acclaimed inventor of the Bonati spine procedures, Alfred Bonati, MD. Now here along with Dr. Bonati, your host, Kimberly Brumell.
Good Saturday afternoon, and thank you for joining us for American Medicine Today. I'm Kimberly Brumell. We have our friend and executive producer of American Medicine Today, Ethan Euchre, here.
I like that you lead out with friend. That makes me feel like we're more than just coworkers. You know what I mean? We're genuine friends here on this show. I like that.
Yes. And we have our senior fellow, another friend.
Yeah, I wouldn't go that
A friendly fellow.
Yes, our senior fellow.
Mr. Jeff Wagstaff,
Yes.
how are you, sir?
I'll be here all afternoon.
Unfortunately.
And we have world-renowned orthopedic surgeon joining us every weekend, and that's Dr. Alfred Bonati of the Bonati Spine Institute.
And I'm not your friend.
Wow.
But as the conversation went before we started the show, we do know that he is world-renowned.
He is
Yes, he
world
is.
renowned, that is for sure. Yes.
Yeah, but we have a diva in the system.
AOB.
If people could just see and hear the things that happen behind the scenes here.
And that's Ms. Diva.
Oh,
Or
Ms. Diva,
Mr.
sorry.
Diva. Does Diva work for men too? I don't know. But anyway, we're a very close, tight family here.
Yes, we are.
And every week we speak to the patients. And what's an amazing theme that we hear is if they've gone through traditional open spine surgery, they have had a tremendous amount of failure with that. They're being slit open in the front, slit open in the back. Sometimes there's hardware being put in, and those things are causing other problems, adhesions, different things happen, and they're not getting the mobility that they should be getting. And oftentimes, more than not, even if they're told that they don't even necessarily could be a candidate for this open back surgery, they're being told there's nothing that can be done. And these poor people, these individuals are being told their life is going to be dependent upon pills. Some are going to be confined to wheelchairs, and that is going to be the rest of their lives. And they're being told that from like age 20, or sometimes we're hearing from people at age 18, and then it spans the gamut into age 60 and older. And how horrible is that, and so depressing. And what we're finding out is once they come to the Bonati Spine Institute, there was always a chance for hope. And they're having their problems resolved. And that's what sets us apart. You don't need multiple reasons to go to other places or multiple reasons to come to us. There's just one that stands out, and it's Bonati succeeds where others fail. And he does that through his patented procedures and with the instrumentation he did. And it's the patented Bonati spine procedures and those tools that exactly pinpoint the person's problem and get them back to life. And on that note, coming up, we're going to be speaking with award-winning investigative journalist Greg O'Brien. He'll be on to discuss being diagnosed early with onset of Alzheimer's at age 59.
Yeah, I didn't even know that was a thing until I went ahead and booked Greg. And at age 59, early onset Alzheimer's disease. I believe his mother suffered from it as well. It's a pretty fascinating story. He wrote the book to sort of document his own mental decline. So it's pretty fascinating. We'll talk to him later on in the show.
Yes.
Scary.
And then we're going to speak with laryngologist, if I pronounce that right, but a voice and throat doctor, Dr. Jamie Kaufman. And she has a book out called The Chronic Cough Enigma. And we actually had her on the television program. Very interesting individual. And then, of course, we'll hear what's new in American medicine today. I believe topic of choice will probably be about the veterans scandal. But up first,
In today's Back to Life segment, we will talk to a patient of the Bonati Spine Institute who went from living a life that was restricted by pain and discomfort through their journey of finding the Bonati Spine Institute and are now living pain-free.
so we have on the line patient Kate Lanier, and I hope I'm pronouncing that right, but we have her on the line from North Carolina. Thank you for being here.
I'm great to be here.
So why don't you kind of walk us through the process? You are very young. What is your age?
I am 29. I'm 21 now. But when all of this started, I just turned 18.
And so what happened? How did you start suffering pain at the young age of 18? What happened to you, Kate?
Well, it actually all started in my leg. I was having real bad leg pain in the summer of 2011, and I was just having pain, and they couldn't figure out there was nothing wrong with my leg, and there was nothing wrong with my knee, and finally they were like, well, let's MRI your back, because sometimes your back can cause pain in your legs. So that's what we did, and in July of 2011, I was diagnosed with degenerative disc disease and spinal stenosis, which they told me at such a young age there was nothing I could do, and eventually my back would just collapse. Which to me at 18 was terrifying. I couldn't stop crying. My parents had to try to calm me down. So we went on, with life. And in January of 2012, I woke up one morning and I couldn't feel the majority of my legs. I was having pain in my back that I couldn't stand up straight. My parents rushed me to the back specialist that they had sent me to down here in North Carolina. And he said, well, there's nothing we can do for you. We're going to give you some Percocet and some Valium. And here is a walker and a wheelchair for you. Here's a prescription for both. You can go get that at your local pharmacy. And, we won't do anything for you. And there's nobody anywhere that can do anything to help you.
So at 18 years of age, you're told that there's nothing they can do. Here's a couple bottles of pills in a wheelchair. God bless you.
Right. And they sent me home, and I was done. I was ready to give up on everything. They told me I would never live a normal life.
Wow.
So what brought you to the Bonati Spine Institute?
Well, my mom, she just refused to accept that, in a world with so much medical advancement, that there was nobody in the whole world that couldn't help with this. So she got on the internet and she started researching the two things that they told me I had, which were degenerative disc disease and spinal stenosis. And she kept researching and she kept researching, and every time the Bonati Spine Institute website kept popping up in her face, and she was like, well, I guess there's something to it. So she clicked on the website and just started reading everything, reading the testimonials from other patients, and saw where you could send in your MRI for free, and they would look at it and tell you right away if they could do something or not.
And Kate, so is that what you did? Did you send your MRI to Dr. Bonati?
Yes, I sent it to him, and then maybe in a day or two, he got back to us and said, we can help you. You don't have to live in pain. Come down here and we can do these surgeries and you'll be fine.
How did that make you feel?
Go ahead.
How did that make you feel?
I was a little skeptical at first because, I'm getting told that there's nothing that anybody can do. So at first I was skeptical and excited and all at the same time, just a whirlwind of emotions. I didn't really know what to expect. So 2 weeks later we got on a plane and we flew down to Florida and started meeting with, as soon as you walk in the door at the Bonati, there's someone there to greet you. And they're just so friendly. And for someone who's already scared and who's already nervous about what's going to happen, that's very, reassuring and very calming to have someone there to just, welcome you and kind of treat you as nice as they can.
Really put you at ease at the Bonati. Yeah.
It did.
So
that was great.
one of the things that the procedure is known for is their conscious IV sedation, where you are essentially awake through the whole procedure. Now, you went through that. Did you watch the procedure on the big screen?
Well, I was told that it helps to watch, and I was terrified already at the thought of being awake during a procedure. So the first one I did not watch the procedure, but ever since the second one and on, I have watched every time. And anyone going through it, I definitely recommend you watch it because it does help you kind of, you know what's coming up, you see what's going to happen, and it really helps you it helps alleviate some of the pain. It helps you get you prepared for it.
Right.
Kate, after that second procedure, when you went into the recovery room, tell us a little bit about what that was like. Were you mobile immediately after the surgery?
Well, after my first surgery, I came to Dr. Bonati and I could not stand up straight. Every time I did, it hurt so bad I couldn't even hardly breathe. After the very first procedure he did, I stood right up and started walking. And my mom couldn't believe it because she went with me, and she had seen how, much in pain I was in when I stood up. And after the very first procedure, I remember waking up and saying, "Oh my gosh, I felt like I got hit by a train," just because the pain of being awake during the surgery is intense. But it's like an outer body experience, because when you wake up, it's like it really didn't happen because you feel good.
Yes.
You're a little sore, but it's nothing compared to the pain that I was in when I went into surgery. And I remember standing up and walking that first time, and I couldn't believe it.
Then after that second surgery, did you experience complete relief?
I did. I felt 110 times better. I remember just being so grateful. I remember I walked back into the room the next day for my follow-up and just gave Dr. Bonatti the biggest hug I could ever give somebody.
Well, Kate, after all your experience at the Bonatti Spine Institute, do you feel comfortable recommending other people who are suffering from back, neck pain to the Bonatti Institute?
I tell everyone I come into contact with, every single person, because he has just done so amazing things for me. I recommend everyone, if you're having any kind of back pain and that you've been told that no one can help you, Dr. Bonatti is the person to go to. In my area, there are people that are now starting to do similar types of procedures that are maybe an hour away from where I live. But I would not go to anyone else but Dr. Bonatti.
Well, you do know a lot of people claim to do minimally invasive, but there's a big difference between the Bonatti spine procedures and just any minimally invasive spine surgery. So continued good health. We're coming up on a break. Thank you for sharing your story back to life at such a young age. I'm glad we were able to help. And as you know, you were diagnosed at age 18, never going to be fully functional. And
it's amazing.
Now you're 21 and you're doing good. So continued good health to you. God bless.
Thank you, Kate.
God bless you. Love you guys.
We love you too.
We love you too. Have a great day. Another success story. Love it.
I know. You're listening to American Medicine Today on News Radio 970 WFLA. Coming up after the break, we're going to hear from award-winning investigative journalist Greg O'Brien, who has been diagnosed with the early onset of Alzheimer's. Coming up after the break. Revolutionary in his field, Dr. Bonatti created, perfected, and patented the Bonatti spine procedures. Using his genius, Bonatti invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonatti spine procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonatti succeeds where others fail.
This is the first time that I am pain-free after 18 years. And it's just wonderful. I love it.
Phenomenal results. No pain whatsoever.
My pain is virtually gone. Nothing short of a miracle.
Those surgeries gave me my life back.
Already I feel like a new person.
I'm going home new. I can chase my grandbaby now. I can garden, I can cook, and I'm really thrilled. The outcome's been remarkable.
I feel 100% better.
It's like a miracle.
It was phenomenal. It literally did change my life.
I was in a wheelchair at that time, and I left here walking.
Every single pain that I had when I came here is gone.
I'm ready to go home and feel great. This place is great. Thank you.
Everything that they said they would do, they have done, and I'm very, very satisfied and happy with those results.
I knew in surgery, in fact I told the surgeon when he relieved the pain off the nerve.
The pain is gone. I'm feeling wonderful.
I have no pain. I feel better than I felt in 4 years from the surgery. It was almost immediate relief.
Today I am totally pain-free, which is just amazing. It's fantastic.
It definitely works. I mean, I really don't know what else to tell you. I'm happy.
Revolutionary in his field, Dr. Bonatti created, perfected, and patented the Bonatti spine procedures. Using his genius, Bonatti invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonatti spine procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonatti succeeds where others fail.
You're listening to American Medicine Today, presented by the Bonatti Spine Institute, featuring the internationally acclaimed inventor of the Bonatti spine procedures, Alfred Bonatti, MD. Once again, here are Dr. Bonatti and your host, Kimberly Brumell.
You are listening to American Medicine Today, brought to you by the Bonatti Spine Institute. I'm Kimberly Brumell, joined by world-renowned orthopedic surgeon Dr. Alfred Bonatti, Jeff Wagstaff, and Ethan Euchre. Now, we have on the phone from New York City, and forgive me if I pronounce this wrong, but I think it's otolaryngologist Dr. Jamie Kaufman, and she's author of The Chronic Cough Enigma. So, with that being said, how many people suffer from asthma?
Well, you know, this book was written in part because I felt as though the medical mainstream hadn't quite got it right. We have now an epidemic of unprecedented proportions for reflux. Silent reflux affects almost half of Americans. And about almost 1 in 10 people has asthma. Asthma affects now 20% of young people that are poor and non-white. So these epidemics have all occurred in the last 40 years. We've found that most people who have asthma, or at least a diagnosis of asthma, actually don't have asthma at all, but it's silent reflux. And there are distinguishing characteristics, and these characteristics are not well known. And that's why I wrote this book.
So, Dr. Kaufman, that's we actually, and Jeff will know who I'm referring to, but we have someone who works in the building here who is constantly coughing, and she's been to all kinds of different people. She's even tried hypnosis and, crazy things like that because nobody knows why she continues to cough like this. So you're saying there's a chance it could be silent reflux? What exactly is that?
Well, the answer is reflux means backflow. I mean, that's literally backflow. And it's gastric backflow or backflow from the stomach. And it comes up into the esophagus, which is a swallowing tube. And everybody's aware of heartburn and indigestion. Most people think heartburn is reflux and reflux is heartburn. But it turns out it's not the case. People with reflux up into the throat, we call that airway reflux, goes into the sinuses, the nose, the voice box, even into the lungs. Chronic throat clearing, postnasal drip, too much throat mucus, a sensation of a lump in the throat, difficulty swallowing, trouble breathing, and then, of course, cough, and that blustery throat clearing kind of cough in particular. And you can differentiate it. People who have reflux tend to cough after meals most. They cough when they lie down at night. Some cough when they bend over, and so on. There are characteristics that allow us to sort them.
Dr. Kaufman, when you have this cough, and the material that you eliminate usually is clear on fluid, but when it is with a mucosity that is yellowish or contaminated, look like an infection, what's the difference between that?
The most common cause of silent reflux is reflux that occurs at night. Americans work longer hours. Maybe they go exercise at the gym afterwards. They get home and they're tired and they're hungry. They eat often the big meal of the day and then go lie down and then maybe get up later and have some dessert and then lie down again and reflux all night. People who have a productive cough, all you have to do is have them cough one time and you hear that chest tracheal rattle. It's diagnostic of chronic bronchitis. And by the way, reflux is the most common cause of COPD and chronic bronchitis as well. So as long as there's a productive cough of any kind, the underlying presumption is bronchitis or even a COPD. When the cough is without any kind, it's a dry cough without any kind of productive output, then that type of cough is often something we call neurogenic, which is more complicated. But the vagus nerve is a very common nerve that gets infected with viruses and then can misbehave, and it can lead to a chronic cough, independent of whether someone has silent reflux or not.
And so if someone has this silent reflux, can't they just take, an antacid or something like that? How does it progress to such a level where just over-the-counter medication doesn't work?
Well, first of all, not only does over-the-counter medication not work, prescription medicine doesn't work either. The most interesting and important article this year in the medical literature that applies to my patients is an article on Barrett's patients. A Danish study looked at 10,000 people who had bad reflux, and the conclusion of the study was that proton pump inhibitors, if you will, purple pills, you all know what they are,
correct,
are associated with an increased, not a decreased risk of development of cancer, esophageal cancer. We know now that reflux, whether people are comfortable or happy about it, is related more to diet and lifestyle than to any other feature or factor in any other treatment that does not involve some change in diet and lifestyle behavior is not going to work.
So is that the treatment for this condition then, is exercise and diet more so than medication?
Well, it's not just diet, it's lifestyle. For example, if you get home at 10 o'clock at night, have dinner, and then go to bed, there is no medical treatment for that. You will have reflux. Mm-hmm. If you're a foodie and every Saturday night you're pushing back from a dining room table at between 11 o'clock and midnight, having consumed 2 bottles of wine, you have reflux. And so there are real discussions to be had. I mean, it gets bigger than this. So 70% of America's calories are, food that has chemicals in it, pre-prepared foods, big relationship between reflux and soft drinks that are highly acidified. But yeah, what I recommend is a 2-week detox. Mm-hmm. It's not easy. No eating and drinking within 4 hours of bed, nothing acidic, nothing out of a bottle or a can, except water and no alcohol.
Oh,
and
you lost me there.
No Diet Dr. Pepper?
No Diet Dr. Pepper. I'm really sorry about that.
I do have a question for you, though. There's a note here, and it says if you have more trouble breathing in or out, that can mean different things. So why don't you sum that up quickly for us?
Well,
Dr.
thank you. It's the most important point. Mm-hmm. Asthma is always difficulty getting air out. It's exhalation, prolonged expiration or exhalation. If you have trouble with breathing problems and you can't get air in, during inspiration, it's reflux, not asthma. Getting air in as a problem is never asthma.
Okay.
Huge for people to know that.
So in is reflux, out is asthma.
Correct.
Okay.
All right, and I'm sure it's all covered in the book, The Chronic Cough Enigma. Dr. Jamie Kaufman. What is Dr. Jamie Kaufman? I have trouble with that word.
I'm a laryngologist. I started out taking care of singers and actors and rebuilding vocal cords. Since that time, we've discovered reflux is the most common cause of hoarseness, and so there it goes.
Interesting. All right. Well, once again, Dr. Jamie Kaufman, pick up the book, The Chronic Cough Enigma. Appreciate you joining us on American Medicine Today.
Thank you.
Thank you. And coming up next, we're going to speak with Greg O'Brien, award-winning investigative journalist who was apparently diagnosed with early onset of Alzheimer's. He'll be coming up after the break.
Scary.
Currently, you're listening to American Medicine Today on News Radio 970, WFLA. Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati spine procedures. Using his genius, Bonati invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati spine procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonati succeeds where others fail.
This is the first time that I am pain-free after 18 years. And it's just wonderful. I love it.
Phenomenal results. No pain whatsoever.
My pain is virtually gone. nothing short of a miracle.
Those surgeries gave me my life back.
Already, I feel like a new person.
I'm going home new. I can chase my grandbaby now, I can garden, I can cook, and I'm really thrilled. The outcome's been remarkable.
I feel 100% better.
It's like a miracle.
It was phenomenal. It literally did change my life.
I was in a wheelchair at that time, and I left here walking.
Every single pain that I had when I came here is gone.
I'm ready to go home and feel great. This place is great. Thank you.
Everything that they said they would do, they have done, and I'm very, very satisfied and happy with those results.
I knew in surgery, in fact, I told the surgeon when he relieved the pain off the nerve.
The pain is gone. I'm feeling wonderful.
I have no pain. I feel better than I felt in 4 years from the surgery. It was almost immediate relief.
Today I am totally pain-free, which is just amazing. It's fantastic.
It definitely works. I mean, I really don't know what else to tell you. I'm happy.
Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati spine procedures. Using his genius, Bonati invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati spine procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonati succeeds where others fail.
You're listening to American Medicine Today, presented by the Bonati Spine Institute, featuring the internationally acclaimed inventor of the Bonati spine procedures, Alfred Bonati, MD. Once again, here are Dr. Bonati and your host, Kimberly Brumell.
Thanks for tuning in to American Medicine Today, brought to you by the Bonati Spine Institute. I'm Kimberly Brumell, along with executive producer Ethan Euchre, Jeff Wagstaff, and world-renowned orthopedic surgeon Dr. Alfred Bonati. Now, on the phone, we have award-winning investigative journalist Greg O'Brien, who was diagnosed with the early onset of Alzheimer's at the age of 59. And he is also author of On Pluto, Inside the Mind of Alzheimer's. So thank you for being with us, Greg.
Thank you.
So, Greg, that's got to be terrifying. I mean, and I mentioned it before that I didn't even realize, when you think of Alzheimer's, like my great-grandmother had Alzheimer's. You think of someone in their 80s, you know, someone in their 90s. You don't think that, you know, an award-winning investigative reporter, super sharp mentally at the age of 59 would be diagnosed. How terrifying that must have been.
Well, you know, I have to start back with my maternal grandfather, George Brown, and as a young man, I saw him die of Alzheimer's, and there was a moment I never will forget. And my mother, Virginia, died of Alzheimer's a few years ago, and I'm the oldest boy in a family of 10, Irish Catholic family, and I was her family caregiver, and that devastated me. But my mother, there are no two, doctors tell me there are no two types of Alzheimer's that are the same, and my mother was able to fight it at some level of articulation, although there were other symptoms that were taking over her pretty close to the end. And she taught me how to live with it. Several years ago, I started the symptoms of short-term memory loss, not recognizing where I was in familiar places, and not recognizing people that I had known all my life. And it was troublesome because, you know, as a journalist, that is kind of the core of what you're being.
Right.
And I was able to manage okay, but it was scaring the crap out of me, if I could say that word. And then I had, a couple years later, a serious head injury riding on a bicycle with my sons. Dumbass that I am, I did not have a helmet. There was a sweatshirt that were on a bike path that slipped from the handlebars into the spokes. I was thrown, and I was going full tilt. And I'll tell you something else stupid. I was riding no-handed. Maybe at that point my brain was not clicking. I often now think of back to when I was a kid rather than ahead. And in the moment I felt like a kid, and I started riding no-handed. I was thrown 30 feet in the air, got my left hand out in front of my head, and the crush went right into my knuckles, cut right down to there. My head went up and bounced down and hit again, and rushed to the hospital, 20 stitches to the face. The symptoms became worse after that. I've had brain scans and SPECT scans and the clinical tests, and when the doctors go in, they could see the area impaired from Alzheimer's, and in another place in my brain, they could see the scar from the head injury, and you know, they, as they say, it unmasked a disease that was going to happen. I also, which isn't, I'm trying to find the right word here, which isn't true of all Alzheimer's people, probably less so, but I have it genetically. I carry a marker gene for Alzheimer's, so.
Greg, question for you. After being diagnosed, watching your grandfather and your mother suffer with this disease, does that perspective, does it help you deal with the disease because you're so familiar with the symptoms and what you're faced with, or does it make it a little scarier knowing what you're faced with?
No, is this the doctor I'm talking to now, or is this?
No, this is not. It's a co-host.
But no, it helps me because I've seen it, and you know, there's, as I write in my book, there's an old saying: anyone who doesn't think they're going to die someday, please raise your right hand. I just know the ending of the book before I get to it, and the other side of it that propels me is I've been a journalist all my life. As an investigative reporter, I covered the mafia, organized crime, and a lot of different political stories around the country, and I reverted in Alzheimer's to what I call, and some doctors call, the muscle memory, which is my writing and communication and reporting. And 7 years ago, my instincts told me to take notes. I took 750 pages of notes watching my mother and me.
Right.
I didn't know what I was going to do with it, but after my mother died, and I saw this, and I because I'm so close to the disease, that what was happening in this country, and I just said, this has to end. And if I have to go and describe the ugly details of this, and there can be a good that comes out of it, so people understand the stereotype of Alzheimer's is not Alzheimer's. The end stage is the stereotype of Alzheimer's when you're in a nursing home and you can't talk. But there are hundreds of thousands or millions of people in early stages of Alzheimer's who are living with it right now. 60% of my short-term memory is gone in 30 seconds. Regularly, I don't recognize where I am. I see people I've known all my life who I don't know. I now, at times, see things that aren't there. The impolite word is hallucination, and they're scary, as my mother had.
Yeah.
I go into tremendous rage. I've lost a sense of space in terms of distance and things like that. And but you know, you got to, in life. You know, also, by the way, I have prostate cancer.
Oh gosh,
and
I'm sorry.
I've chosen not to treat it because I think we're a ways away from a cure. And I've seen the inside of a nursing home. They're wonderful places, but I don't want to go there in Alzheimer's. And that's an end game strategy for me, and I'm hoping what comes out of this book is that people realize that there are millions of people suffering who are afraid to talk about it. And in time, yes, I won't be able to speak.
Right.
And in time, yes, they won't be able to speak. But damn it, we have to start screaming while we can speak now until people take this disease serious, all stages, not just the end.
Craig, this is Dr. Bonatti. Craig, let me ask you something. This is amazing what you accomplish. You're saying that you lose some contact with reality sometimes and things like that, but I'm hearing you and your way to communicate and the words that you're using and the correction that you're using is amazing. Is anything that you apply, that you develop some techniques or something like that to maintain this integrity of your vocabulary? Because one of the first things that goes away is finding words to be able to communicate. So the people start to talk about, and if they need to talk for a car and they cannot find the word, they use a vehicle or whatever, and they change words. Is that techniques that you use? Because you may need to not only teach, but probably you need to give this information to the public that has this type of a disease. And the problem is that if you learn some techniques, those techniques, they need to be exploited. They need to be known, because it's amazing the way that you communicate, man.
Well, Doctor, I describe Alzheimer's as a plug in a loose socket. Mm-hmm. The plug is loose and the light is dimming. And then the plug falls out and you put it back in, and eventually the plug falls out, mm-hmm. and it doesn't go back in, and you go dark. I have moments when I can't find words. As a journalist, for an interview like this, I'm surrounded by my notes here. Mm-hmm. It's my intellectual training. I have moments during the day of strong articulation and moments of the day when it's not. I describe my brain as like an iPhone.
Okay.
It's sophisticated, but there are times when it shuts down, shuts off. And the scary thing, Doctor, is you never know. And I'm able in this early stage to get a sense on, I could never do this interview in the morning or at night. Those are my two worst times. Mm-hmm. And when I do something like this, it takes an awful lot out. A lot of it is my training as a journalist and what I call, faith, hope, and humor to mm-hmm. try to get through this. And I do have strategies. I take copious notes. I never go away from my laptop. Everything I write down. I email myself sometimes 100 times a day with stuff because I don't want to forget.
Well, Greg, the whole journey is chronicled in your new book called On Pluto, Inside the Mind of Alzheimer's, award-winning investigative journalist, once again diagnosed with early onset Alzheimer's at the young age of 59. Greg O'Brien, we'll certainly keep in touch with you, Greg, yes. And just the best of luck to you, sir.
Thank you very much. I appreciate it.
Yeah, thank you for sharing your story. Again, you can get On Pluto, Inside the Mind of Alzheimer's on Amazon.com.
Thanks, Greg.
Also, you could get it on my website, on Pluto.org.
On Pluto.org. All right. Well, have a great rest of your day there, Greg.
Thanks. Thank you very much.
Thank you. Fascinating story. So tragic, too.
It is.
I really think he had some training, something that he developed that probably he doesn't really has no cognition because of the time that he's using it. And I'm telling you, this is something that needs to be. I think we need to bring him back and explore his mind a little bit more.
Let's do that for sure.
I think so. Coming up next, we have Dr. Jamie Kaufman. She is a throat and voice doctor from New York City, and she's going to be speaking to us about the chronic cough enigma. After the break, you'll hear more. You're listening to News Radio 970, WFLA.
Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati spine procedures. Using his genius, Bonati invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati spine procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonati succeeds where others fail.
This is the first time that I am pain-free after 18 years. And it's just wonderful. I love it.
Phenomenal results. No pain whatsoever.
My pain is virtually gone. Nothing short of a miracle.
Those surgeries gave me my life back.
Already, I feel like a new person.
I'm going home new. I can chase my grandbaby now. I can garden. I can cook. And I'm really thrilled. The outcome's been remarkable.
I feel 100% better.
It's like a miracle.
It was phenomenal. It literally did change my life.
I was in a wheelchair at that time, and I left here walking.
Every single pain that I had when I came here is gone.
I'm ready to go home and feel great. This place is great. Thank you.
Everything that they said they would do, they have done, and I'm very, very satisfied and happy with those results.
I knew in surgery, in fact I told the surgeon when he relieved the pain off the nerve.
The pain is gone. I'm feeling wonderful.
I have no pain. I feel better than I felt in 4 years from the surgery. It was almost immediate relief.
Today I am totally pain-free, which is just amazing. It's fantastic.
It definitely works. I mean, I really don't know what else to tell you. I'm happy.
Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati spine procedures. Using his genius, Bonati invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati spine procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonati succeeds where others fail.
You're listening to American Medicine Today, presented by the Bonati Spine Institute, featuring the internationally acclaimed inventor of the Bonati spine procedures, Alfred Bonati, MD. Once again, here are Dr. Bonati and your host, Kimberly Brumell.
You're listening to American Medicine Today, brought to you by the Bonati Spine Institute. I'm Kimberly Brumell, joined by Ethan Euchre and our senior fellow, Jeff Wagstaff, and, of course, world-renowned orthopedic surgeon, Dr. Alfred Bonati, and...
Let's look at what's new in medicine today, featuring Alfred Bonati, MD.
Well, Dr. Bonati, I know you were getting revved up still about the veterans and the VA hospital debacle, so why don't you elaborate more?
Well, I think we need to maintain pressure on this. Our veterans are not being treated right, and more than 1,000 veterans lost their lives due to the mismanagement of the VA.
Correct.
If you look, recently there was allocated around $20 billion on the VA from the beginning of the Iraq War till now. And the problem is those $20 billion with B, they were assigned not to give care to the veterans. They were assigned to non-related projects like office managers, office makeovers, some type of amuse softwares, and undocumented purchases on credit cards by the government, and all this, and even was assigned to one call center that has 2.4 calls per day. So as you see, meanwhile we have the government taking care of the veterans, we are going to have this abuse. Irresponsible people is in charge, irresponsible results are going to be there. And we are going to continue crossing our fingers, because any time that we cry about this, they promise us a lot of solutions, but no solutions happen. If you start to look right now, what happened on the VA is a turmoil. We continue with this amount of no results on the times that the patient needs to be seen. There are situations, for example, in New York, that the patient in the VA wait around 600 days before he has an appointment.
Unbelievable.
That's ridiculous.
You die before you're seen.
Oh, absolutely. That's what's happening. Now, and at the same time, the worst part of it is the individuals that they are being responsible to treat these patients, and I am really very upset with the physicians that they are on these VAs. If you see that the patients are being treated right, if you see that the patients not receiving the proper care, if you see that the physician sees that the patients are not properly taking care, they should resign.
Correct.
They should abandon these organizations immediately, so the pressure is so strong that the solutions are going to happen. But these people are probably very poor physicians that they are not being able to survive outside, and they live in this type of a niche.
Right.
And the worst problem with that is when you see these veterans, the amount of drugs that they are using on the veterans in these last 12 years went to 270% higher than 12 years ago. You're seeing these vets, because they come and they have some pain, and instead to look to eradicate the problem, they give them narcotics. So not only you are increasing the amount of drug addiction, but now you are increasing these people making more appointments because now they need this drug.
Yes.
So the whole system is corrupted, and the only way to stop this corruption is get the politicians out of the system and give the money to the vets so they can go to real doctors.
Well, you know what was interesting? When we had David Jolly in studio, he talked about how the management had elected themselves and given themselves, what, $800 and some
million
dollars in raises. Now, that money could have gone directly to help the veterans that are needing this medical care, don't you think?
Why? They're politicians. Why they're going to do that?
But he put a hiring, not a hiring freeze, but a raise freeze on current management. But I think you need to get rid of the inefficient management to make this work.
Kimberly, how long do you think it's going to last?
Well, Dr.
Around
Bonatti,
a couple of weeks? Well, a couple of weeks, then they're going to come back. Once you have a corrupted system, they know how to turn around this, and they're going to continue doing the same. And the politicians are part of this system. They promise a lot of things, they do things, but they don't have enough power to do, or otherwise they contemporize just only to create votes.
Let me just stop you for a second, because we have a comment, a question line. If people have a Twitter account, they can tweet at Dr. Bonatti or hashtag American Medicine Today. But on that note, we actually had a listener call in, and she said that she was part of the VA. They had canceled her appointment 2 times, and this was at Bay Pines. She was told to come in early, go to a floor she had never been on before. She said there was one person up there, a nurse. She took her temperature, did this, left the room. A doctor, a foreign doctor, came in, spoke with her, said, "You're running a bit of a temperature, but it's no problem," and turned and walked out. She was the only person on this floor, and she said, I don't know what happened. That was my doctor's appointment. That was the VA appointment.
Well, this is a VA appointment, and you know something. This is going to be the Cadillac of Obamacare for the nation. People don't understand that when you create a corrupted system and you create that system that doesn't work, is a problem for the patient.
Correct.
Not for the doctor, neither for the politician, neither for the insurance, is a problem for the patient.
Right.
And this is why we need doctors, we need to fight this system. We need to create a response of physicians against anything that the politicians are going to touch or do with medicine.
Correct. And for those that are listening, if you want to reach out to the program itself, you can call 727-495-5200. If you or someone you know is suffering with back, neck, sciatic pain, headaches, fibromyalgia, RSD, you can reach out to the Bonati Spine Institute at 855-267-0483 or visit bonati.com. Again, we're on American Medicine Today on WFTS ABC 28 from 7 to 7:30. We go national August 17th on Fox Business News, Sundays 5:30 to 6. And again, you can tune in to News Radio 970 WFLA next week, noon to 1.
Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati spine procedures. Using his genius, Bonati invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati spine procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonati succeeds where others fail.
This is the first time that I am pain-free after 18 years. And it's just wonderful. I love it.
Phenomenal results. No pain whatsoever.
My pain is virtually gone. Nothing short of a miracle.
Those surgeries gave me my life back.
Already, I feel like a new person.
I'm going home new. I can chase my grandbaby now. I can garden. I can cook. And I'm really thrilled. The outcome's been remarkable.
I feel 100% better.
It's like a miracle.
It was phenomenal. It literally did change my life.
I was in a wheelchair at that time, and I left here walking.
Every single pain that I had when I came here is gone.
I'm ready to go home and feel great. This place is great. Thank you.
Everything that they said they would do, they have done, and I'm very, very satisfied and happy with those results.
I knew in surgery, in fact I told the surgeon when he relieved the pain off the nerve.
The pain is gone. I'm feeling wonderful.
I have no pain. I feel better than I felt in 4 years from the surgery. It was almost immediate relief.
Today I am totally pain-free, which is just amazing. It's fantastic.
It definitely works. I mean, I really don't know what else to tell you. I'm happy.
Revolutionary in his field, Dr. Bonati created, perfected, and patented the Bonati spine procedures. Using his genius, Bonati invented precise tools necessary to minimize surgery, scarring, anesthesia, and recovery. So successful are the Bonati spine procedures, they consistently reflect over 94% patient satisfaction. 45,000 successful procedures have been performed exclusively at our location. Nearly half our patients suffer from failed back and neck surgeries at other facilities. Bonati succeeds where others fail.